Your questions, Dr. Todd Ellerin, Chief of Infectious Diseases at South Shore Health. Dr. Ellerin, good to see you.
Good to see you.
So a lot has happened over the last 48 hours, and of course hearing blood clots in the same sentence as vaccine is very scary for a lot of people. So we know the risk is very low, lower perhaps than 1 in a million. What do you want people to know about that potential risk?
Ben, I want people to know, just as you said, it's extremely rare. And what we're learning now from new studies out of the UK, although these have not been peer reviewed, is that the risk of COVID-19 induced brain clots is actually 8 to 10 times higher than those from vaccines that have been given in Europe and in the United States. So I think that still the benefits far outweigh the risks. And I also want people to know that the fact that the FDA and the CDC have a surveillance system in place that can catch rare side effects at a rate of 1 in a million is really a testimony to how we prioritize safety here in the United States.
Yes, and we've been hearing that. So again, given how extremely low this risk is, why did the CDC react in such a dramatic way? Are you concerned that perhaps people may never agree to take this shot because of all of this now?
Erica, of course, this could affect vaccine hesitancy, and there may be people that unfortunately never want to get the vaccine. But I think, the important part is that the FDA and the CDC saw that there were some clots after vaccine from the Johnson & Johnson vaccine, and having the knowledge that this somewhat mirrors what we've seen rarely after the AstraZeneca vaccine, knowing that they share the same platform, those viral vector vaccines. I think that's what came with a sense of urgency. But I want to, again, reiterate that the benefits far outweigh the risks.
So the CEO of Pfizer today, switching gears to another vaccine, said there's a good chance that everybody getting vaccinated now may need a booster shot, so a third dose of Pfizer in about a year. What's the reasoning behind that, and are you surprised?
I'm not surprised, and he may be right about that. Remember, this virus, especially since it goes unchecked and is replicating throughout the world, the fact that many and most countries so far have actually not begun vaccinating their population, and that most of the world probably won't be fully vaccinated for a few years. All of those things is a setup for the fact that while this is a pandemic, it will likely be endemic, meaning seasonal in many places throughout the world. And because of that, and because of all these variants that are forming, it likely will look more like influenza. Will we need a booster every year versus every 2 or 3 years? That remains to be seen. But I think it's a good bet that we will need a booster at least at some point.
Thanks, Dr. Ellerin. And now, before we let you go, we wanted to offer our condolences to you and your colleagues at the Brigham. We know last week you lost an important ally in this battle against COVID. Dr. Francisco Marti, an infectious disease specialist at Brigham and Women's Hospital. He died in a fall while in the Dominican Republic, and we know you knew him personally.
Yeah, Erica, he was an exceptional, Dr. Marti was an exceptional infectious disease physician. He mentored many of us, and as you can see, he was only in his early 50s. He was a similar age to us, but he was an incredible teacher. He had a brilliant mind, and he had an unbelievable work ethic. And it's unbelievable. Every week he used to come to me, we'd see each other on Mondays, and he'd say, "In Todd we trust." But the truth of the matter is, it's really Dr. Marti that we all trusted, and he's going to be sorely missed.
Our thoughts and condolences with you, Dr. Ellerin, and your work colleagues on that loss.
Thank you.